want to thank all of you for coming out today, and we're very excited about this partnership and looking forward to kind of starting this series of talks with all of you. So, as David said, I'm Dr. Elizabeth Collins. I'm one of the geriatricians at Jefferson. Please call me Beth. I prefer that. I am joined by two of my mentors, Dr. John Lee Antonio and Dr. Brooke Salzman as well, and they'll be kind of helping to field questions. And what I hope this will be is an interactive talk today. So we're going to start with just some basic information about strokes. I'd like to play a video for you, and then we'll sort of open it up to the floor for questions, and hopefully you'll find this informational and helpful to you and any of your loved ones who have stroke. Okay? So I want to start off by asking all of you, what do you know about stroke?
Okay.
What sorts of things come to your mind when you think about stroke, or what jumps out at you?
High blood pressure?
Absolutely. Definitely. He said high blood pressure causes stroke. Other people?
Blood clot.
Blood clots cause stroke, absolutely. Yep.
That you have a short time to turn it around?
Absolutely. It's important to identify it fast, yeah. Which is going to be a reoccurring theme word today, fast.
Paralysis can result.
Right? Absolutely. Okay.
Is it always sudden?
So we'll talk a little bit about that. Typically, stroke does happen suddenly, although kind of these mini strokes can happen over a long period of time, and people can have kind of residual effects from multiple strokes over time.
When you say mini strokes, what does that
Yeah.
entails?
Yeah, so it's something called a TIA, a transient ischemic attack, and we'll talk a little bit more about that in a second, just to kind of clarify what a stroke is with a capital S and a mini stroke or a TIA, okay? So I first want to start off by having you watch this video that I think is really, it's fun, it's cute.
Every 2 seconds, someone somewhere in the world experiences a stroke, and 1 out of every 6 people will have one at some point in their lives. Strokes deprive brain cells of oxygen and are one of the most common causes of death and a leading cause of preventable disability. When someone experiences a stroke, quick medical care is critical and can often help avoid permanent brain damage. But what causes strokes in the first place, and what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of the oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply the front of the brain, and vertebral arteries supply the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is interrupted, oxygen delivery stops and brain cells die. There are 2 ways this can happen. Hemorrhagic strokes are when a perforated vessel allows blood to leak out. But the more common type is the ischemic stroke, when a clot blocks a vessel and brings blood flow to a halt. Where do these clots come from? On rare occasions, a sudden change in heart rhythm prevents the upper chambers of the heart from contracting normally. This slows down blood flow, allowing platelets, clotting factors, and fibrin to stick together. The clot can be carried up towards the arteries and blood vessels supplying the brain, until it gets to one it can't squeeze through. This is called an embolism, and it cuts off the oxygen supply to all the cells downstream. The brain doesn't have pain receptors, so you can't feel the blockage itself. But oxygen deprivation slows brain function and can have sudden, noticeable effects. For example, if the affected area is responsible for speech, an individual's words may be slurred. If the stroke affects a part of the brain that controls muscle movement, it can cause weakness, often just on one side of the body. When this happens, the body will immediately try to compensate by diverting blood flow to the affected area, but this isn't a perfect solution. Eventually, the oxygen-deprived cells will start to die, leading to brain damage that may be severe or permanent. That's why it's important to get medical care as fast as possible. The first line of treatment is an intravenous medication called tissue plasminogen activator, which can break up the blood clot and allow blood to flow again in the compromised artery. If it's delivered within a few hours, this medication greatly increases the chance of surviving the stroke and avoiding permanent consequences. If tissue plasminogen activator cannot be given because the patient is on certain medications, has history of major bleeding, or the clot is particularly large, doctors can perform a procedure called an endovascular thrombectomy. Using a fluorescent dye that illuminates the blood vessels under a strong X-ray, the physician inserts a long, thin, flexible tube called a catheter into an artery in the leg and maneuvers it all the way to the blockage. A retriever is passed through this catheter. It expands and anchors into the clot when it's just past it. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out fast if someone is having a stroke. So how can you tell? Here are 3 quick things to try. 1. Ask the person to smile. A crooked mouth or facial drooping can indicate muscle weakness. 2. Ask them to raise their arms. If one drifts downward, that arm weakness is also a sign of a stroke. 3. Ask them to repeat a simple word or phrase. If their speech sounds slurred or strange, it could mean that the language area of their brain is oxygen deprived. This is sometimes called the FAST test, and the T stands for time. If you see any of those signs, call emergency services right away. Lives may depend on it. We're on a nonprofit mission to revolutionize education. Click here to learn how you can get involved.
Okay. Any questions or thoughts that come up after watching that? Yeah.
So it mentions that TPA, the drug, why can't that be preventative?
So that's
Panic.
so that's a great question. In some cases, for people at very high risk of stroke, they are given blood thinners. They're not the same as TPA. TPA comes with a very high risk of bleeding, which in fact is often outweighs the risk of stroke, and that's kind of why it's not given. And in fact, it's even in patients who come in with a stroke, many times we don't give TPA because it's so dangerous and people are at higher risk for bleeding. So it's really kind of a life-saving drug if nothing else is going to work. Yeah. Let's.
Let me ask you something. Don't cigarettes play a part in that too?
What's that?
Smoking cigarettes.
Yeah, absolutely. And we're going to talk a little bit about kind of things you can.
Your heartbeat, pace.
Yeah, we know that cigarettes can not only damage your heart and your lungs, but also your blood vessels, and that includes the blood vessels in your brain, putting you at higher risk for having a stroke.
Isn't it advantageous to take aspirins if you think you're having a stroke?
Yeah, and aspirin is in that category, kind of with the TPA. It's a little less. It's certainly less dangerous than TPA, but it's important to talk to your doctor before starting aspirin because certain people can be at higher risk of bleeding, and even aspirin, which we think of as a pretty safe drug, we can buy it in Walgreens or at drugstores. Even that can come with the risk of bleeding. So it's certainly a medicine we put patients on every day to lower their risk of stroke. But unfortunately, it also increases their risk for bleeding in their head or bleeding in their digestive system.
Is that if you're on blood thinners or it doesn't matter?
So what, the bleeding? Yeah. I mean, it can happen not taking blood thinners too, but it's certainly more frequent on blood thinners like aspirin. Yeah.
Fish oil.
Yeah.
I've heard both good and bad things about it, that it can prevent a stroke and it can cause a stroke.
Yes.
So
Yeah.
what's the-
Yeah. And I don't know if you two have other thoughts about that. I know that there isn't strong evidence either way for fish oil. I think there was certainly a period where we thought fish oil had a lot of benefits. And now we're sort of seeing that, unfortunately, nothing really substitutes for a healthy diet and exercise.
Fish oil is probably one of those things similar to like calcium and things like vitamin D that you can often get from your diet. So while it certainly doesn't seem that there's much harm with fish oil, I'm not sure how helpful it is in preventing these things that we at one time thought that it was actually more helpful than it is.
I'm gonna actually just present a couple of slides kind of reiterating the information that you saw in the video, and then we'll kind of open it up for discussion, okay? So what is stroke? So when we talk about stroke, we're really talking about a brain attack. So we all worry and we all are concerned about having a heart attack. There's a big push in public health circles to call stroke brain attack to make it sound as important and potentially life-threatening as heart attack, because it is. So there are two big ways that strokes can happen. One is through the mechanism of a blood clot getting stuck in one of those smaller smaller blood vessels in your brain. And that's called an ischemic stroke, or ischemic means kind of lack of oxygen. So as that blood clot travels through your blood vessels, it blocks off a certain part of your brain and doesn't allow that part of your brain to get oxygen, and eventually that part of your brain dies. The other kind of stroke is called hemorrhagic stroke. It's not nearly as common as ischemic stroke. Sort of when we think of stroke, we think of ischemic stroke. But hemorrhagic stroke can happen with if somebody has an aneurysm in their brain that bursts, or if there's a blood vessel in your brain that ruptures, that can certainly cause it too. So again, either way, blood doesn't get to your brain. The brain cells die without the oxygen that the blood carries, and that part of your brain, whatever that part of your brain controlled, now is affected.
So you're saying if that happens, that means one side or wherever that it started at,
Yeah.
that's the side that's going to be affected?
So that's a good question. Actually, the human brain's a little interesting in that the things that affect the left side of our bodies actually are in the right side of our brain. So they cross over. So if a blood vessel on the right side of your brain is affected, then the left side of your body would go weak. Yeah.
Are strokes hereditary?
They are, yeah. So, and certainly, just because a loved one of yours or a parent, a grandparent, a brother, sister had a stroke doesn't mean that you are predetermined to definitely get a stroke. But you do have higher risk. One thing we know about neurons, or brain cells in particular, is they take a very, very, very long time to reproduce. So like if you lose some skin cells, for example, they turn over pretty rapidly. Brain cells take years and years to kind of reproduce, and there are some that never come back. So that's kind of what makes stroke so bad. Yeah. So just some quick facts about stroke. I know everyone in this room cares very much about stroke, but why should we as a society at large care about stroke? So stroke is the 5th leading cause of death in the United States. It comes after things like heart disease and cancer, so it is certainly up there. About every 4 minutes, someone in the world dies of stroke. Also, stroke is probably the leading cause of disability in the United States. So strokes often don't kill their victims immediately, but often it leads to a long it can lead to disability in the long term, so weakness on one side of your body or difficulty with speech that keep you from being as independent as you want to be. Stroke reduces mobility, in particular, in older adults, in about 50% of them. And again, as Heshi pointed out, early identification of stroke is absolutely crucial. And as you were talking about with the story of your mom, too, getting to what's called a stroke center or a hospital that specializes in stroke care is important. And we'll talk a little bit about how you can best do that. And then it's also estimated that about 80% of strokes can be prevented. So I do want to give you some hope and not have everything be doom and gloom, that you can do something to help reduce your risk of stroke.
What can a person do for any kind of training as far as to learn?
Yeah.
Like if a family member or a person or a friend that's having a stroke right then and there, what can I do until the paramedics or whatever?
Right, yeah.
That's the question.
So we'll talk a little bit about that, okay? So we'll talk about what to do sort of when you suspect someone is having a stroke, and that FAST thing that they talked about in the video, that's kind of what we're going to talk about a little bit, okay?
Calling 911 is number one. The first time you see something like that, call 911. That's the first thing you do no matter what. And then after that, to make sure that person's safe as you're waiting for them.
What do you mean safe?
If somebody could potentially fall and hurt themselves.
No, I'm talking about the person is going through what they're going through.
Right.
I'm not feeling what they're going through as far as their heart or whatever they're going through as far as
Right.
what they're feeling.
Right.
Why they having it. I'm
Right.
saying, what can I do to help maintain until the paramedics do come or whatever? That's what
Help
I'm
them
asking.
sit down somewhere safe so they're not going to fall or something like that, because somebody who's having a stroke who actually falls can get really hurt.
Okay.
So that's something you could probably do in the interim that would
Lay them
help.
down on their back or side or what?
Sit down on a chair, anything like that, just to make sure that they're not going to fall.
Thank you.
Yeah.
Sure. I know that sometimes when people are having seizures, we're always taught to put them on their side. That's not necessarily important when you suspect a stroke. Sometimes it can be a little tough to decide what exactly is going on. Yeah.
You say give someone an aspirin, is that good or bad?
So that typically we don't, because unfortunately we don't know what kind of stroke it is. So if it's a hemorrhagic stroke or a stroke caused by bleeding, that could potentially make it worse. So that's kind of something that doctors and nurses and the healthcare team decide in the hospital. Okay. So what puts people at risk for stroke? Sort of many things. Being an American, so having a diet high in trans fat, saturated fat, and salt, not being physically active, and we'll kind of talk about how much activity is really recommended to reduce your risk for stroke and heart attacks, obesity, too much alcohol, smoking, and then some diseases like high blood pressure, which someone mentioned before, high cholesterol, diabetes, an irregular heartbeat, or something called atrial fibrillation, which is the most common irregular heartbeat. That's a big one, and in fact, when people have that, we put them on blood thinners typically, if their risk is high enough for stroke. Heart disease, sickle cell disease, having a stroke before or having had a mini stroke or TIA, being female, having genetics and family history that predispose you to it, being of certain heritage, African American, American Indian, or Latinx, and being older puts you at higher risk for stroke, unfortunately, as well. So how can you prevent stroke? So fortunately, the things that prevent stroke also prevent a lot of other bad things. I wish that I could give you a pill that I could say would 100% prevent stroke and reduce your risk of stroke, but unfortunately, the best things are often the hardest things. So doing things like having a healthy diet. And by that, people often ask kind of, what does that mean? I mean, eating plenty of fruits and vegetables, avoiding foods that are high in saturated fats. Sometimes people talk about shopping in the perimeter of a supermarket rather than in the places where things are canned and boxed and processed. Trying to maintain a healthy weight or get to a healthy weight, staying active or getting active. And when we talk about that, a lot of people are confused about what being active means. That means doing some kind of activity for 2.5 hours a week, which can be broken up into half an hour a day or things like that. And it needs to be of moderate intensity. So that means you can talk, but if you tried to sing a song, you'd have a hard time doing it. Okay, so that's really what qualifies as moderate. Stop smoking, or don't start. If anyone's thinking about starting, please don't. Don't drink too much alcohol. The cutoff for too much alcohol is no more than 2 drinks a day for men and no more than 1 drink a day, sorry, women, for women. Okay, so how else? So those are kind of lifestyle things. How about how can you reduce your risk when you know you have diseases that put you at higher risk for stroke? Have your cholesterol checked at least once every 5 years, and probably more frequently if you know you have high cholesterol. Check your blood pressure regularly and talk to your doctor about how you can get your blood pressure to come down if you're having a hard time with it being high. Talk to your doctor about getting tested for diabetes. Diabetes puts you at higher risk, unfortunately, of both stroke and heart attack. And if you have diabetes, keeping it under good control is really going to lower your risk substantially. Because the problem with diabetes, you can kind of think of the sugar, high rates of sugar in your blood can kind of cause your arteries to get clogged up and your blood vessels to kind of get clogged somewhat. It's not quite that simple, but essentially that's kind of how things work. If you talk to your doctor also about about any heart disease you have or atrial fibrillation, talk to them about what you can do to reduce your risk of stroke. Blood thinners in certain patients, and again, that depends on a lot of different things, can help to reduce your risk of stroke. So generally, as doctors, when we decide to put somebody on a blood thinner, we look at their risk of bleeding, we look at their risk of having a stroke, and we sort of weigh which one is higher and decide whether or not to use a medicine like aspirin or warfarin's another big one, or some of the new blood thinners as well. Take your medicine for high cholesterol, for high blood pressure, heart disease, and diabetes. And I really encourage you, I know it can be difficult to kind of get a good relationship with a physician, but I really encourage you to talk to your provider and be honest about your fears and your concerns about your risk for stroke. Okay, so you suspect a loved one is having a stroke. So what are some of the things you can do? So for the kind of big acronym we think of, or the word we think of, is the word FAST. So F stands for face. So I want you to have that person smile, and if their smile is not even or asymmetrical, that may clue you into them having a stroke. Next is their arms. So I want you to have them stick their arms out kind of like a zombie, and if one of them drifts down, that's a sign, okay? Then ask them to say a sentence or a phrase like "the sky is blue." That's the S for speech. And if they say it slurred, like they've had a couple drinks, or if they or something like that, that's a key that they may be having a stroke as well. And then the T is for time. So again, as John was saying before, it's absolutely essential that you call 911 as soon as possible. And one thing to know, and we talk a little bit about this, is not bringing the person to your closest hospital yourself. Because especially with stroke, it's very important that you call EMS or emergency medical services to bring you to the hospital, or call an ambulance to bring you in, because they can take you to a stroke center or a hospital that's specialized to do things like give TPA or to do one of those procedures to get the clot out. So this just reiterates it. Again, F for face drooping, A for arm weakness, S for speech difficulty, and T is for time to call 911. Yeah.
What are the stroke centers in Philadelphia?
Yeah, that, I know that Jefferson is certainly a stroke center. Penn, Aria, Temple, I believe. Yeah.
Sure,
Hahnemann. Yeah. So fortunately in Philadelphia, we're lucky enough to have many stroke centers. It's a bigger issue kind of in rural America where there are smaller community hospitals. But generally most larger hospital systems, large academic centers are stroke centers. Yeah. Okay. Again, call 911 right away. Don't drive to the hospital and by yourself if you think you are having a stroke by any means, and don't drive your loved one there. It's really important that you call the ambulance to bring them there so they can take you to the right place. Okay, so what do you do? So somebody you love is having a stroke, or God forbid you are having a stroke. What do you do? So you come into the emergency room, you talk to the triage nurse and the doctors, and they're gonna order what's called a brain scan, which is a CT test or an MRI of your head. And the reason they do that is to find out what kind of stroke you're having, or if in fact you're having a stroke, because stroke can look like other things too, to see how they can treat you best. Because again, if you're having one of those strokes that are caused by bleeding, we don't want to give you a drug that could cause more bleeding. So for ischemic stroke, if you get to the hospital within 3 hours, you might get that TPA, or that clot busting drug. It's called tissue plasminogen activator. That improves the chances of your recovering from the stroke and getting back to where you were before the stroke. And again, but that medicine is very, very dangerous, and often we don't give it because people are on blood thinners already, or they may have other risks of bleeding that outweigh their risk of passing away from the stroke.
Once you, say for instance, once you say you get, once I say I have a stroke, a minor or whatever, and I get to the hospital, okay, can that ever resurface again for me to have it again?
Yeah.
I mean, even if they looked at my brain, my head, and they find out what kind it is,
Yeah.
and they can't, and if even if they can fix it, I will still have that same problem always?
Yeah, so the thing, first of all, the TPA that we give, or any kind of treatment for stroke, isn't 100% effective. So a lot of times people wind up with certain kinds of weakness in their body or trouble with speech or other things that they never quite get back fully. The other thing, unfortunately, when you have a stroke, you're actually at higher risk for having a second stroke or another stroke. So really kind of our biggest goal is preventing that first one. Yeah, sure. Good question though. And then the second kind of stroke, or that hemorrhagic stroke, it can be caused by bleeding in your brain, and often it's sort of one of those aneurysms, or kind of a bubble of blood that bursts, and brain surgeons can go into your brain, into the blood vessels in your brain, and place a coil or place some kind of block that helps to stop the bleeding. Oftentimes when it's very severe, they may even do brain surgery to try to stop the bleeding. Okay? So how else? And this is really what stroke treatment is about. And that's not in the hands of doctors, that's in the hands of the professionals who do rehabilitation, with physical therapy, with speech therapy, with occupational therapy. Oftentimes you'll need to go to a rehab facility like Moss or McGee are kind of the big ones around here, and they can help you get back to being independent and help and doing the things you love to do. And then again, we also talk about preventing other strokes, and sometimes your doctor will say you should be on an aspirin, or you should even be on a medicine called Plavix or clopidogrel that might lower your risk of having another stroke. Okay. And so I gave you a bunch of sources here. They're all pretty well vetted. I got most of the information from this talk and from the handouts that we have back there from either the Stroke Association or the Center for Disease Control, which can be a good resource for people. So I wanted to kind of open things up to discussion, questions, personal experiences with stroke. Yeah.
You said you talk about mini strokes.
Yes.
Yeah. The thing I'm curious about, is it possible to have a stroke when you're asleep and then wake up feeling
Yeah.
like you've had something?
So unfortunately, you can have a stroke when you're asleep, which is particularly scary. Sometimes people wake up and realize they can't move their left side or can't speak properly. So yeah, that can happen. And you're right, I did promise I would talk about TIAs or mini strokes more. So that happens when there's a blood clot that goes into your vessels, but then it passes. So oftentimes people will have problems that like their face will droop, but it'll only happen for a few minutes to hours, and then they'll come back from that. That is still not cool because it means you're at very high risk for having a stroke. So don't let the mini word fool you. It's a big problem.
Do TIAs also lead to memory loss problems?
Absolutely. Yeah.
That's in there.
Yeah. So oftentimes people can have multiple mini strokes or have multiple kind of what we call ischemic changes of their brain, meaning there are multiple little strokes that can happen, and that can lead to something called vascular dementia, which is a form of dementia like Alzheimer's is, that can cause memory impairment.
How do you know that you're having them? Is there a way to, because
So-
it's not the same thing as a major stroke.
Right, exactly, yeah. So oftentimes they go unrecognized. The most important thing is to kind of maintain a healthy lifestyle to prevent them from happening. Sometimes people don't know that they're having them.
So it's also somewhat similar to somebody who's having chest pain but not having a full-blown heart attack. And so if somebody's having TIA symptoms, it's really important to get checked by your doctor. Even if it's something that comes and goes, you're at a pretty high risk of having a stroke if you have a TIA. So it's something you want to get checked by your facial droop, weakness, slurring of the speech, forgetfulness, that kind of comes and goes. Having kind of signs of a stroke that kind of go away without treatment. So it's like you're having a stroke, but then in a couple hours, it kind of goes away. If you're having a stroke, those symptoms won't go away.
Yes?
Yeah.
I wanted to know about the difference between what a CT scan and an MRI scan and why one's preferred, or if there's a sequence of doing those.
Yeah, sure. So typically we get CT scans first because they're very fast. CT scans stand for computed tomography test. I had to think for a minute. And it's essentially a series of x-rays that takes a look inside of your brain. It often can't see things to quite the same level of detail as an MRI, but that's enough to kind of usually to tell whether or not you're having a stroke and what kind of stroke it is. An MRI is a longer test. It takes longer to perform. There are fewer MRI machines, typically because they're very expensive, so hospitals only have a few, like 1 or 2 each. And they show a high level of detail of your brain, and they use a very strong magnet. That's kind of the science behind them. Sure, of course. Yeah, sir.
Just a couple minor questions. You recommend monitoring your blood pressure.
Mm-hmm.
The issue I've always had with that is when I come to my favorite family physician at Jefferson, and the person who admits me takes my blood pressure, and she gets one reading.
Mm-hmm.
And then my favorite family physician at Jefferson comes in and takes my blood pressure and gets a completely different, actually a significantly different reading. And I find the same thing no matter what blood pressure cuff I use at home.
Yep.
So what's the sense?
Yeah, great question.
Okay, good.
So, yeah. Oh, yeah, right. So as we go through our day, our blood pressures fluctuate considerably, okay? In most people, and that's normal. Sort of when you're sitting, relaxing, blood pressures tend to go down. As you're getting up, as you're doing exercise, blood pressures tend to go up. Or eating, yeah, sure. Or coffee or things like that can affect it. Even kind of moment to moment, honestly. What we look at when we're diagnosing someone with high blood pressure is a trend. So a trend of blood pressures over a certain range.
Actually, that's very helpful. And then I have one other question related to getting to the hospital.
Yeah.
Would a test that you would be given when you showed up relate to somehow checking out your vascular system using dyes and other chemicals?
Mm-hmm.
And if you were allergic to betadine,
Mm-hmm.
how do you let people know when you might not be thinking of it right then, because you're,
Right.
don't you dare put that stuff in me.
Yeah.
I mean, or whatever the iodine, I recently was admitted to a emergency room where they were wise enough to ask me beforehand, we can't do this because you're allergic to the iodides, I guess.
Right. So a couple of things about that. First, when we're looking at stroke, we usually don't order it with contrast, which is kind of the dye that they use to look closer at your vessels. So usually in an emergency situation like that, we don't use it. If you are allergic to iodine, it's important to tell the people who are taking care of you for sure. But most dyes that are used these days don't contain iodine. Some of them still do. So it's important to let them know that, and sometimes they can use one that isn't. So if you tell them, they can enter it into their computer system or into your chart, and believe me, allergies are flagged big time in charts and when physicians are ordering things or things. Yeah.
Okay, and just one other Philadelphia-specific related.
No problem.
Suppose you suspect you're having a stroke and call 911, and there are several hospitals near you that could treat you. And of that group, there's one that you've had a very, very bad negative experience in their emergency room.
Yeah.
How do you get the police not to take you to your nearest emergency room, but to take you to either one where your family doctor is or where you've been before and know that you get good care?
Right.
Is that possible? Or is initial stroke treatment general enough that you really can't go wrong unless they leave you on the gurney?
Right.
Okay.
Yeah. No, I mean, that's something that all emergency medicine doctors and providers need to know inside and out, because it's definitely something that's very important. When you call the ambulance, they really they're required by law to take you to the closest hospital. So if you go to a hospital that you don't like, get stabilized in the emergency room, you can always ask to be transferred to the hospital where your doctor is. Yeah, that happens a lot. Sure.
I've been hearing a lot, there's a lot of these imaging centers that have popped up. I've heard conflicting of you get too many false positives and things. Is it really worth it to do that? I mean, I know they can, for a couple $100, you can get your arteries see if they're clogged and all of that. I mean, what's your thoughts on that?
Yeah. So
And when should you start that,
Right.
if that's something?
Right. I think we in primary care may have different opinions than the neurologists and neurosurgeons about this, but generally it's not indicated, and it doesn't seem to prevent stroke through screening any more than controlling your cholesterol, controlling your blood pressure, and kind of the normal things that we do. I had a patient this morning actually ask me about those tests, and they're being marketed pretty heavily, but I do want to kind of very heavily. But and other doctors may say they're valuable, but kind of from our experience, I think we all can agree that they're probably not necessary. Yeah. So.
Is different than a heart attack. Is a stroke generally a painless activity?
Generally, yeah. So that's really kind of when you have to look for those signs of weakness or speech problems or confusion, things like that.
So
Yeah.
down an arm, more likely a heart attack issue, not a stroke issue.
Potentially, or other things. Yeah.
I didn't want to belabor this, but you did say not to give aspirin for a stroke. But you do give aspirin for a heart attack?
Yes.
Okay.
Yeah.
So you got to know the difference.
Right. That's definitely true. So a stroke won't present with crushing, tight chest pain. It won't present with shortness of breath. That's a heart attack. So those are times to give aspirin. Because when we were talking about how a stroke happens, really that heart attack can only happen one way, and that's through that clot. Okay. So that's why you give aspirin for that. Yeah.
I want to go back to your advice about not having a friend bring you or taking yourself to
Yeah.
the emergency room. And that was sort of predicated upon the fact that you wanted us to get to a certified stroke center.
Right.
But for those of us who live in Philadelphia and are
Yes.
close to a lot of hospitals
Yeah.
and have developed prejudices about some hospitals or others,
As we all
or
have.
no doctors in one hospital or the other, I'm leaving this thinking I would call a cab or a friend. Because I haven't heard you say anything about an intervention that an EMT will do that will make a difference on the way to the hospital. Am I right in assuming that?
Yes, in the sense that if you're just having weakness, if you're just having trouble speaking, that getting to a stroke center within 3 hours is appropriate. The things that I will say is, first, when you come in via ambulance into an emergency room, the doctors immediately evaluate you. That's not always the case when you walk in. Yeah. The other thing is sometimes strokes can affect your areas of your brain that control breathing, that control other vital things that EMTs can provide a lot of support for. Yeah.
So, I had bypass surgery, so I take aspirin.
Yes.
Probably, for all the reasons why I had bypass surgery, I'm probably a candidate for a stroke. And so, isn't there kind of a push-pull here? I'm taking my 80 milligram aspirin for my heart, which could put me at risk for a bleed in my brain. I mean, how do you work with both those factors?
So I think that really requires your provider looking at the individual patient, looking at you specifically, and seeing what your family history is, if you've had bleeding before, to kind of assess. And there are different tools that doctors use also to assess how much of a risk of bleeding you have, and how much of a risk of stroke or heart attack or things that can be caused by the clots you have. And typically for people who've had heart attacks in the past, their risk of having another heart attack or a stroke is higher than their risk of bleeding generally. Yeah.
I'm just curious if there's a connection to strokes and, I'm going to pronounce it wrong, but cerebral palsy. Because I know I just had a family member that they went into the hospital because they weren't sure if it was stroke or that. And so I wanted to know, because they have the same symptoms where one side is drooping, and so I was just curious if there's a...
So cerebral palsy is usually something that happens, I don't know if you guys want to... Oh, okay.
Because Bell's palsy, I don't know if that's, because Bell's palsy is
Yeah.
a type of one-sided facial droop that can be caused by a virus or different things that people often wonder if it's that, or can be confused with a stroke. Cerebral palsy is more something that someone may be born with, so I think it may be Bell's palsy.
See, that's why I knew I was going to say it wrong.
Yeah, no, that's okay.
Yeah, no, but absolutely. But
Yeah.
Bell's palsy absolutely can be one of those things that mimic stroke, and that someone will have weakness just on their face, and usually with treatment over time it will improve.
But that's a good question. That's,
One or two more.
Sure. Yeah.
My question is this. I'm in my middle 50s. And I didn't see people older than me, or a doctor may prescribe a person to take an aspirin every day. Is it a particular age that you have to start to do that, or?
So I would really recommend you talk with your provider about whether or not that's best for you. Because you know, a few years ago we kind of said that across the board everybody should be taking a baby aspirin, and then we saw kind of increased risk of bleeding. So we don't often kind of recommend that across the board.
Right, that's my next thing, because I can't take ibuprofen. Because it's something that does what like I'm supposed to be anemic to a degree.
Yeah.
And I was told that, and I was shocked, and I never thought I was going to be, I was anemic. But it's just that, what are the other aspirins that I can take other than ibuprofen that I'm supposed to take regular, like take one aspirin a day?
Yeah. So aspirin is similar to ibuprofen. It's in the same category of medicines with Motrin, with Aleve, with Advil, naproxen, all of those kind of medicines. They're all in one category of medicine. Tylenol is really going to be your best bet in terms of acetaminophen for treating pain. Yeah, because it does not come with an increased risk of bleeding.
Thank you.
Yeah, sure.
One question on other comorbidities, things like, you know, we're talking about oxygen getting to the brain and all. What about like COPD, which is more, gets common as you, in a lot of older people? Is that a contributing factor?
So not directly. So COPD doesn't put you at higher risk for stroke. COPD can lower the amount of oxygen your blood has, and that tends to be like a slower process of your brain not getting enough oxygen. It's not really quite related. Yeah.
Along those lines, what about HIV? Are people that have HIV need to be more concerned about stroke?
Yeah, so we unfortunately are still learning a lot about what it means to live long-term with HIV, but we suspect that, like having a higher risk for heart attack, that people living with HIV are at higher risk for stroke because of having the virus long-term in your body causes an inflammatory process that can sometimes hurt your vessels in a way that would put you at higher risk.
Even when you're taking your medicine regularly?
Yeah, so it's really important that you take your medicine regularly, because if you got that viral load suppressed, that inflammation is going to go way down. But there is some thought that even when you're taking your medicines regularly and you have your HIV under good control, that you may have higher risk. Yeah.
I was just going to say that there's some discussion about reservoirs of viral load in your brain, and that those reservoirs are what are a leading cause of inflammation.
Yeah.
And so even if you are taking meds, they may not be getting to the reservoirs in your brain.
Yeah.
So you still have that cause of inflammation. And so inflammation is one of the causes of heart attack and stroke.
I have a question, thank you. I take aspirin each day, it's prescribed. Now, I can't remember when I was told to take this. When something like that is you're told to take, is it because your family have a history of hearts and strokes and cancer? My mother and father both had bad hearts. My sister had a bad heart. I had a heart murmur, but that was when I was a child.
Okay.
Every now and then I get tight in the chest, but I didn't think it would require an aspirin.
Right.
And as my husband just asked about we spoke about having HIV. When you have a diagnosis of AIDS, after that, does the risk of things, strokes and heart attacks, increases because of that? Even though your health rebounds and things, it's taken forever for my blood counts and stuff to go up. It's dreadful.
Yeah.
So.
Yeah.
I know.
Yeah. So you're saying is the worse your HIV, the higher your risk? Is that what you're asking?
Yeah. I mean, even after you start to regroup, your body starts to regroup itself. I don't have no way of putting this right. She can help me out.
So even as you start to rebound from your high viral load, so you're doing everything you should, you're taking all your meds, you're undetectable, your CD4s have increased. Are you still subject?
Yeah.
So your HIV's in check, but are you still subject to heart attack, stroke, even under those optimal conditions of HIV?
Yes,
suppression?
and we think it's probably because of what Heshi was talking about, the reservoirs of HIV we can't get to via drugs yet.
Oh.
Yeah, causing inflammation. So we think you're at lower risk if your HIV is well controlled, but if you, if you're being HIV positive, period, living with HIV is a risk factor. Okay. Yeah. One more question, and then I think we probably should.
That you either can take to help prevent a stroke, or that may actually help cause a stroke. I'm thinking of calcium. I take calcium. Is that is it good or bad or indifferent?
So calcium in particular is one that has a lot of debate up for it. There's some studies that show that it may put you at higher risk potentially, maybe slightly higher, of having a heart attack. But there are also some people who say you need calcium for strong bones. We tend to recommend that people get their calcium by eating lots and lots of fresh fruits and vegetables, and dairy, milk and cheese and other things that have calcium in them, rather than taking them. In terms of supplements that cause stroke, I can't think of any or put you at higher risk.
The only one is vitamin E that used to be recommended, but there have been some studies that suggest that it may put people at higher risk of stroke. So we do avoid high-dose vitamin E.
How about that was good for skin and hair?
So vitamin E, So there are a couple, right? Who needs a brain when you have?
I take the capsule and open it up, and
and that's okay because it's not getting to your digestive system.
But don't it absorb? Your body absorbs that, don't it?
A very small amount. Very small amount. Yeah, but vitamin E, and that's E as in elephant for people who may not have been able to hear. It's a vitamin that you need, that your body needs, but if you take it via pill in large quantities, that can put you at higher risk. Yeah, and unfortunately there's no easy magical supplement or drug that we've really been able to come up with that substitutes for a healthy lifestyle, healthy diet and exercise. So, all right, everyone. Thank you all for coming out. This was wonderful. Thanks so much.